this is Dr. Praveen here. So today I am going to read out a article named as Pharmacological Evaluation of the Anesthetic and Analgesic Potential of Injection HARSHA 22, a novel polyherbal local anesthetic formulation intended for the parenteral administration in the Wistar albino rats. So this is the injection called HARSHA 22, which is under the animal study conducted by Pankajakasturi Herbal India, and many other departments have got involved in this. So totally, it's an Ayurvedic anesthetic polyherbal preparation. So they have brought a gel as well as injection. That is, injection name Harsha 22 showed anesthetic effect up to 90 minutes after the application, and even after the injection also it has showed the median duration of analgesia in rats administered subcutaneously with the injection Harsha 22 and the lignocaine solution was 90 minutes and 35 minutes respectively. So it has acted, Harsha 22 acted for 40 minutes, whereas the lignocaine 2% has acted for 35 minutes. Hence, it can be concluded that injection Harsha 22 can become a prominent substitute for the lignocaine or lidocaine, we can say, as the local anesthetic agent after establishing its efficacy through the stringent clinical trials in the human. So human trials not yet happened here. So the only animal trials has taken place. So Harsha in 22 was formulated using the hydroalcoholic extract of the herbs Syzygium aromaticum, that is nothing but the lavanga, Myristica fragrans, that is jathifala, okay, Aconitum heterophyllum, that is Ativisha, Aconitum chasmanthum, that is Vatsanaba, and this is the Jetamansi. So these are the five main herbs, particularly the lavanga, that is Syzygium aromaticum, is the main drug here. And see, simultaneously, these drugs are proven anti-inflammatory also. So this is not only going to act as an anesthetic, this is going to act by as well as the anti-inflammatory also. So the materials and methods has been discussed in this article, and they have conducted on the albino rats, and the main uh, criteria is taken as the tail flick latency test to demonstrate excellent anesthetic effect of the injection Harsha 22. So this is the tail flick latency is taken as the main studying method. And here in this graph you can see this is a standard, this is in a control study, that is normal saline injected, and this is the tail flick latency test has shown a significantly equivalent action in comparison to the lignocaine. See, black color is the control one. This is with the normal saline, almost has very minimal effect, and red one is the test, and this blue is sorry, green one is the standard. This is the standard one. So for test and standard, almost equally they are effective, and somewhat more this test drug is somewhat more effective than the standard one. So the further comparison has done here. So just I am reading the highlighted areas. The most widely recognized mode of action for the local anesthetics is the interaction with the voltage gated sodium plus channels to inhibit the sensory and motor function. So probably the same method is taking place here also. And lastly, the conclusion, the results of radiated heat tail flick latency test and the Vivo analgesic duration test with the electrical stimulation indicated that the test material injection Harsha 22 had comparable local anesthetic activity to that of the a commercially available lignocaine 2% formulation. Hence, it can be concluded that injection Harsha 22 will become a prominent substitute for the lignocaine after the establishing its efficacy through the stringent clinical trials in human. Since this formulation is purely of the herbal origin, it will be a great asset for the Ayurvedic professionals to carry out the surgical procedure recommended by the Central Council of Indian Medicines. See, I hope this will get proven safe and effective in the human also, and as well as I hope even many formulations has come uh, in few around 1 or 2 decades before, and they have withdrawn from the market saying that this is not the route of administration of the medicine according to Ayurveda. See, this has decided in the forum of Honorable Supreme Court only, and Supreme simultaneously in the Muktiar Chand versus State of Punjab, the Honorable Supreme Court also declared that Ayurveda has a authority to adopt the modern methods or recent methods of the in the betterment of patient. So if this polyherbal medicine comes, so definitely there will be a minimal allergic reactions and simultaneously an added advantage in concern to the economical things also as well as, and this will going to be become the one of the best anesthetic available, and it simultaneously becomes the Indian contribution in the field of medicine. So hope for best, and I hope this will clear the women's clinical trials also, and if it enters into market, then this is going to be a big boom in the field of Ayurvedic surgery. Thank you.